Scapular abduction and upward rotation. Serratus anterior muscle. Testing for grade 3. Fair. Position of patient. For all grades, short sitting over end or side of table, hands on lap. Position of therapist. Standing at test side of patient. Hand giving resistance is on the arm proximal to the elbow. The other hand uses the web space along with the thumb and index finger to palpate the edges of the scapula at the inferior angle and along the vertebra and axillary borders. Test. Patient raises the arm to approximately 130 degrees of flexion with the elbow extended. The patient is instructed to raise his arm forward above his head. Grade 3. Fair. Scapula moves through full range of motion without winging but can tolerate no resistance other than the weight of the arm. Testing for grade 5 and grade 4. The patient is instructed to raise his arm forward over his head. Keep his elbow straight and hold it. And don't let the therapist push his arm down. Grade 4. Good. Scapular muscles give or yield against maximal resistance given on the arm. The glenohumeral joint is held rigidly in the presence of a strong deltoid, but the serratus yields and the scapula moves in the direction of adduction and downward rotation. Grade 5. Normal. Scapula maintains its abducted and rotated position against maximal resistance given on the arm just above the elbow in a downward direction. Grade 2 testing. Poor. Position of patient. Short sitting with arm flexed above 90 degrees and supported by examiner. Position of therapist. Standing at test side of patient. One hand supports the patient's arm at the elbow, maintaining it above the horizontal. The other hand is placed at the inferior angle of the scapula with the thumb positioned along the axillary border and the fingers along the vertebral border. Test. Therapist monitors scapular motion by using a light grasp on the scapula in the inferior angle. Therapist must be sure not to restrict or resist motion. The scapula is observed to detect winging. The patient is instructed to hold his arm in the position of above 90 degrees, let it relax, and then hold his arm up again and let it relax again. Grade 2. Poor. If the scapula abducts and rotates upward as the patient attempts to hold the arm in the elevated position, the weakness is in the glenohumeral muscles. The serratus is graded to poor if the scapula does not smoothly abduct and upwardly rotate without the weight of the arm, or if the scapula moves towards the vertebral spine. Position of the therapist. Support the patient's arm at the elbow, maintaining it above 90 degrees. Use the other arm to palpate the serratus with the tips of the finger just in front of the inferior angle along the axillary border. The patient is instructed to try to hold his arm in this position. Scapular elevation. the upper fibers of the trapezius muscle. Grade 3 testing. Position of patient, short sitting, over and or side of table, hands relaxed in lap. Position of the therapist, standing behind the patient. The patient is instructed to shrug his shoulders or raise his shoulders. Grade 3, fair. Elevates shoulders through range but takes no resistance. Grade 5 and Grade 4 test. The patient is instructed to shrug his shoulders or raise his shoulders towards his ears. Hold it and don't let the therapist push them down. Grading. Grade 5. Normal. Patient shrugs shoulders through available range of motion and holds against maximal resistance. Grade 4. Good. Patient shrugs shoulders against strong and moderate resistance. The shoulder muscles may give at the end point. Grade 2, Grade 1 and Grade 0 testing. Position of patient, prone or supine, fully supported on table. If prone, head is turned to one side for patient's comfort. If supine, head is in neutral position. Position of therapist, standing at test side of the patient, supports test shoulder in palm of one hand. The other hand palpates the upper trapezius near its insertion above the clavicle. The patient is instructed to raise his shoulder towards his ear. Grade 2, poor. Patient completes full range of motion in gravity eliminated position. Grade 1. Upper trapezius fibers can be palpated at clavicle or neck. The levator muscle lies deep and it's more difficult to palpate in the neck, between the sternocleidomastoid and the trapezius. It can be felt at its insertion on the vertebral border of the scapula in superior to the scapular spine. Scapular abduction, the middle fibers of the trapezius muscle. Grade 5, Grade 4 and Grade 3 testing. Position of patient, prone with shoulder at edge of the table. Shoulder is abducted to 90 degrees. Elbow is flexed to a right angle. Head may be turned to either side for comfort. Position of therapist, standing at test side close to the patient's arm. Stabilize the contralateral scapular area to prevent trunk rotation. There are two ways to give resistance. One does not require as much strength as the other. 1. When the posterior deltoid is grade 3 or better, the hand for resistance is placed over the distal end of the humerus and resistance is directly downward towards the floor. 2. When the posterior deltoid is grade 2 or less, resistance is given in a downward direction towards the floor, with the hand contoured over the shoulder joint. The patient is instructed to lift his elbow towards the ceiling. Grade 3. Completes available range but without manual resistance. The patient is instructed to lift his elbow towards the ceiling, hold it, and don't let the therapist push it down. Grade 4. Good. Tolerates strong or moderate resistance. Grade 5. Normal. Completes available scapular adduction range and holds the position against maximal resistance. Grade 2, Grade 1 and Grade 0 testing. Position of the patient and therapist, same as for normal test except that the therapist uses one hand to cradle the patient's shoulder and arm, thus supporting the arm's weight, and the other hand for palpation. The patient is instructed to lift his elbow towards the ceiling. Grade 2, poor. Completes full range of motion without the weight of the arm. Grade 1 and Grade 0. A Grade 1 trace muscle exhibits contractile activity or slight movement. There will be neither motion nor contractile activity in the Grade 0 muscle. Scapular depression and adduction, the lower fibers of the trapezius muscle. Grade 5, Grade 4 and Grade 3 testing. Position of the patient. Prone with test arm overhead to about 145 degrees of abduction. Forearm is in mid position with the thumb pointing towards the ceiling. Head may be turned to either side for comfort. Position of the head. Standing at test side. Hand giving resistance is conjured over the distal humerus just proximal to the elbow. Fingertips of the opposite hand palpate for Grade 3 below the spine of the scapula and across the thoracic vertebrae, following the muscle as it curves down to the lower thoracic vertebrae. The patient is instructed to raise his arm from the table as high as possible. The patient is instructed to raise his arm from the table as high as possible, hold it, and don't let the therapist push it down. Grade 5, normal. Completes available range and holds it against maximal resistance. This is a strong muscle. Grade 4, good. Takes strong to moderate resistance. Grade 3, same procedure is used, but patient tolerates no manual resistance. Grade 2, Grade 1 and Grade 0 testing. Position of therapist. Standing at test side, supports patient's arm under the elbow. The patient is instructed to try to lift his arm from the table past his ear. Grade 2, poor. Completes full scapular range of motion without the weight of the arm. Grade 1, trace. Contractile activity can be palpated in the triangular area between the roof of the spine of the scapula and the lower thoracic vertebra, T7 to T10. That is the course of the fibers of the lower trapezius. Grade 0. No palpable contractile activity. Scapular adduction and downward rotation. Rhomboids muscle. Grade 5, Grade 4 and Grade 3 testing. Position of the patient. Prone. Head may be turned to either side for comfort. Shoulder is internally rotated and the arm is adducted across the back with the elbow flexed and hand resting on the back. Position of therapist. Standing at test side, when the shoulder extensor muscles are Grade 3 or higher, the hand used for resistance is placed on the humerus just above the elbow, and resistance is given in a downward and outward direction. The patient is instructed to lift his hand. The patient is instructed to lift his hand, hold it, and don't let the therapist push it down. Grade 5, normal. Completes available range of motion and holds against maximal resistance. The fingers will pop out from under the scapula when strong rhomboids contract. Grade 4, good. Completes range and holds against strong to moderate resistance. Fingers usually will pop out. Grade 3 Fair. Completes range but tolerates no manual resistance. Grade 2, Grade 1 and Grade 0 testing. Position of patient. Short sitting with shoulder internally rotated and arm extended and adducted behind the back. Position of therapist. Standing at chest side, support arm by grasping the wrist. The fingertips of one hand palpate the muscles under the vertebral border of the scapula. The patient is instructed to try to move his hand away from his back. Grade 2 Poor. Completes range of scapular motion. Grade 1 Trace and 0. A grade 1 muscle has palpable contractile activity and grade 0 muscle shows no response. Scapular depression. Latissimus dorsi muscle, teres major muscle, posterior deltoid muscle. Grade 5 and Grade 4 testing. Test for latissimus dorsi. Position of the patient. Prone with head turned to the chest side. Arms are at side and shoulder is internally rotated. Palm up. Test shoulder. Position of the therapist. Standing at chest side. Grasp the forearm above patient's wrist with both hands. The patient is instructed to reach towards his feet, hold it, and don't let the therapist push his arm upward towards his head. Grade 5 Normal. Patient completes available range against maximal resistance. If the therapist is unable to push the arm upward using both hands for resistance, test the patient in the sitting position as described in Test 3. Grade 4 Good. Patient completes available range of motion, but the shoulder yields at end point against strong resistance. Shoulder flexion. Anterior deltoid muscle, supraspinatus muscle, and coracobrachialis muscle. Grade 3 testing. Position of therapist. Stand at chest side. Test. Patient flexes shoulder to 90 degrees. The patient is instructed to raise his arm forward to shoulder height. Grade 3 Fair. Completes test range 90 degrees but tolerates no resistance. Grade 5 and Grade 4 testing. Position of therapist. Stand at chest side. Hand giving resistance is contoured over the distal humerus just above the elbow. The other hand may stabilize the shoulder. The patient is instructed to raise his arm forward to shoulder height, hold it, and don't let the therapist push it down.
Grade 5 Normal. Holds end position 90 degrees against maximal resistance. Grade 4 Good. Holds end position against strong to moderate resistance.
Grade 2, Grade 1, and 0 testing. The patient is instructed to try to raise his arm. Grade 2 Poor. Completes partial range of motion since it is against gravity. Grade 1 Trace. Examiner feels or sees contractile activity in the anterior deltoid but no motion occurs. Grade 0 No contractile activity. Shoulder extension. Posterior deltoid muscle. Shoulder extension Grade 3 and Grade 2 testing. Position of patient. Prone with head turned to one side, arms at sides, Test arm is internally rotated, palm up. Position of therapist. Stand at test side. The patient is instructed to lift his arm as high as he can. Grade 3. Fair. Completes available range of motion with no manual resistance. Grade 2. Poor. Completes partial range of motion. Grade 5 and Grade 4 testing. Position of therapist. Standing at test side, hand used for resistance is conjured over the posterior arm just above the elbow. The patient is instructed to lift his arm as high as he can, hold it, and don't let the therapist push it down. Grade 5, normal. Completes available range and holds against maximal resistance. Grade 4, good. Completes available range but yields against strong resistance. Grade 1 and Grade 0 testing. Position of therapist. Standing at test side, fingers for palpation are placed on the posterior aspect of the upper arm. The patient is instructed to attempt to lift arm from the table on request. Grade 1, trace. Palpable contractile activity in any of the participating muscles but no movement of the shoulder. Grade 0, shoulder abduction. Middle deltoid muscle and supraspinatus muscle. Grade 5, Grade 4 and Grade 3 test. Preliminary evaluation. Examiner should check for full range of shoulder motion in all planes and should observe scapula for stability and smoothness of movement. Position of the therapist. Standing behind the patient, hand giving resistance is conjured over arm just above the elbow. The patient is instructed to lift his arm out to the other side to shoulder level. Hold it and don't let the therapist push it down. Grade 5, normal. Holds end position against maximal downward resistance. Grade 4, good. Holds end position against strong to moderate downward resistance. Grade 3, fair. Completes range of motion to 90 degrees with no manual resistance. Grade 2 testing. The patient is instructed to try to lift his arm out to the side. Grade 1 and Grade 0 testing. Position of therapist. Standing behind and to the side of patient. Therapist cradles test arm with the shoulder in about 90 degrees of abduction, providing limb support at the elbow. The patient is instructed to try to hold his arm in this position. Grade 1, trace. Palpable or visible contractions of deltoid with no movement. Grade 0, no contractile activity. Shoulder horizontal abduction. Posterior deltoid muscle. Grade 5, Grade 4 and Grade 3 testing. Position of patient. Prone, shoulder abducted to 90 degrees and forearm off edge of table with elbow straight. The patient is instructed to lift his elbow up towards the ceiling, hold it, and don't let the therapist push it down. Grade 5, normal. Completes range and holds end position against maximal resistance. Grade 4, good. Completes range and holds end position against strong to moderate resistance. Grade 3, fair. Completes range of motion with no manual resistance. Grade 2, Grade 1 and Grade 0 testing. Grade 0. No contractile activity. The patient is instructed to try to move his arm backward. Grade 2. Poor. Moves through full range of motion. Grade 1. Trace. Palpable contractions, no motion. Shoulder external rotation. Infraspinatus muscle and teres minor muscle. Grade 5, Grade 4 and Grade 3 testing. Position of patient. Prone with head turned towards test side. Shoulder abducted to 90 degrees with arm fully supported on table. Forearm hanging vertically over edge of the table. Place a folded towel under the arm at the edge of the table if it has a sharp edge. The patient is instructed to raise his arm to the level of the table. Hold it and don't let the therapist push it down. Therapist may need to demonstrate the desired motion. Grade 5. Normal. Completes available range of motion and holds firmly against resistance. Grade 4. Good. Completes available range, but the muscle at the end range yields or gives away. Grade 3. Fair. Completes available range of motion but is unable to take any manual resistance. Grade 2, Grade 1 and Grade 0 testing. Position of patient. Short sitting with elbow flexed to 90 degrees and forearm in neutral rotation with hand facing forward. Position of therapist. Standing or sitting on a low stool at test side of patient at shoulder level. One hand stabilizes the outside of the flexed elbow while the other hand palpates for the tendon of the infraspinatus over the body of the scapula, below the spine in the infraspinatus fossa. The patient is instructed to try to push his forearm away from his stomach. Grade 2. Poor. Completes available range in this gravity eliminated position. Grade 1. Trace. Palpation of either or both muscles reveals contractile activity but no motion. Grade 0. No palpable or visible activity. Shoulder internal rotation. Suprascapularis. Grade 5, Grade 4 and Grade 3 testing. Position of patient. Prone with head turned towards test side. Shoulder is abducted to 90 degrees with folded towel placed under distal arm and forearm hanging vertically over edge of the table. Position of the therapist. Standing at test side, stabilize the scapular region if muscles are weak or perform test in the supine position. The patient is instructed to move his forearm up and back. Hold it and don't let the therapist push it down. Demonstrate the desired motion to the patient. Grade 5. Normal. Completes available range and holds firmly against strong resistance. Grade 4. Good. Completes available range, but there is a spongy feeling against strong resistance. Grade 3. Fair. Completes available range with no manual resistance. Grade 2, Grade 1 and Grade 0 testing. Position of short sitting with elbow flip and forearm in neutral rotation. Position of therapist. Standing at test side or sitting on low stool, one hand stabilizes the forearm while the other hand palpates for the tendon. The patient is instructed to try to pull his forearm towards his stomach. Grade 2, poor, completes available range. Grade 1, trace, palpable contractions occur. Grade 0, no palpable contractions. Shoulder horizontal adduction, pectoralis major muscle. Grade 3 testing, preliminary examination. Supine, shoulder at 90, abduction, and elbow at 90 of flexion. Position of therapist, standing at side of shoulder to be tested. The other hand is used to check the activity of the pectoralis major on the upper aspect of the chest, just medial to the shoulder joint. Test. For both heads, patient horizontally adducts extremity across chest in a straight pattern with no diagonal motion. For clavicular head, direction of motion by the patient is diagonally up and inward. For sternal head, direction of motion is diagonally down and inward. The patient is instructed same as for the grade 5 test, but no resistance is offered. Grade 3, fair. Patient completes available range of motion in all three tests with no resistance other than the weight of the extremity. Grade 5 and Grade 4 testing. For both heads, the patient is instructed to move his arm across his chest. Hold it and don't let the therapist pull it back. For clavicular head, the patient is instructed to move his arm up and in. For the sternal head, the patient is instructed to move his arm down and in. Grade 5, normal, completes range of motion and takes maximal resistance. Grade 4, good, completes range of motion and takes strong to moderate resistance, but muscle exhibits some give at the end of range. Grade 2, Grade 1 and Grade 0 testing. The patient is instructed to try to move his arm across his chest. Grade 2, poor. Patient horizontally adducts shoulder through available range of motion with the weight of the arm supported by the examiner. Grade 1, trace, palpable contractile activity. Grade 0, no contractile activity.